Welcome back to the Victory Education Lounge. I'm your host Maurice, and today we're tackling a crucial topic for sickle cell warriors: Infection Shield, Boosting Immunity in Sickle Cell, Part 27. Before we dive into this vital information, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people with this life-saving knowledge about infection prevention in sickle cell disease. For individuals living with sickle cell disease, infections aren't just an inconvenience, they can be life-threatening. Today we'll explore why sickle cell patients are more susceptible to infections, how to build a robust infection shield, and strategies to boost your immune system. Remember, while infections pose a serious risk, with the right knowledge and precautions, you can significantly reduce your vulnerability. Have you ever wondered why individuals with sickle cell disease are more susceptible to infections? It's a question that might have crossed your mind, especially if you or a loved one are living with this condition. But don't worry, we're here to shed some light on this important topic. Let's start with the basics. Sickle cell disease is a genetic disorder that affects the shape of red blood cells. Instead of being round and flexible, these cells are sickle-shaped, rigid, and sticky. This irregular shape can cause blockages in small blood vessels, leading to a myriad of complications. One of these complications is an increased risk of infection. But why does this happen? Well, it has to do with the spleen, an organ that plays a vital role in our immune system. The spleen filters our blood and helps our body fight off infections. In people with sickle cell disease, these sickle-shaped cells can block the blood vessels in the spleen. Over time, this can damage the spleen and make it less effective at fighting off infections. Moreover, these irregularly shaped cells also have a shorter lifespan than normal red blood cells. This means the body is constantly working to produce new cells to replace the ones that have broken down. This constant turnover can strain the immune system, leaving it less able to ward off infections. So individuals with sickle cell disease have a double whammy: a less effective spleen and an overworked immune system. Both these factors make them more vulnerable to infections, but this doesn't mean that infections are inevitable. Far from it. Understanding your increased risk is the first step towards infection prevention. With the right information and strategies, you can build a robust infection shield and safeguard your health. Let's explore how in the next few scenes. Stay tuned. Vaccines play a crucial role in shielding you from dangerous infections. Immunizations are one of the most effective tools we have in our infection prevention arsenal. They work by stimulating our immune system to recognize and fight specific viruses or bacteria, which helps to prevent us from getting sick if we are exposed to these pathogens in the future. For individuals with sickle cell disease, staying up to date on vaccinations is particularly crucial. Due to their condition, they are more susceptible to certain infections, and these infections can be severe or even life-threatening. Vaccines act as an essential line of defense, helping to protect these individuals from a wide range of potentially harmful infections. One of the most important vaccines for sickle cell patients is the annual flu shot. Influenza can be especially severe in people with sickle cell disease, and the flu shot is the best way to reduce the risk of contracting this illness. In addition to the flu shot, there are several other immunizations that are typically recommended for sickle cell patients, including vaccines for pneumococcal disease, meningococcal disease, and hepatitis B, among others. It's important to note that everyone's vaccination needs may be slightly different, depending on factors such as their age, overall health, and specific type of sickle cell disease. Therefore, it's crucial to work closely with your healthcare provider to ensure that you're receiving all of the appropriate vaccinations for your individual situation. While vaccines are generally safe and effective, they can sometimes cause mild side effects such as a sore arm or low-grade fever. However, these side effects are typically short-lived and far less serious than the illnesses that vaccines help to prevent. Vaccinations are a powerful weapon in the fight against infections. They provide us with a safe and effective way to bolster our immune defenses and protect our health. Being diligent about vaccinations can significantly reduce your infection risk. So make sure to keep up with your vaccination schedule, because every shot is a step towards building a stronger infection shield. Preventive antibiotics or antibiotic prophylaxis can be a powerful tool in your infection prevention arsenal. These are not your typical antibiotics that you take when you've got a nasty bug. No, these are special. They're preventive, which means they're taken regularly, often daily, to help prevent infections before they even start. Now you might be wondering, why would anyone take antibiotics if they're not sick? Well, individuals living with sickle cell disease have a higher risk of certain bacterial infections. This is because their spleen, an organ that helps filter bacteria from the blood, may not work as effectively due to the disease. That's where antibiotic prophylaxis steps in, acting like a shield, blocking these potentially harmful bacteria from causing infections. But it's not just any bacteria that these antibiotics are fighting against. They are particularly effective against pneumococcal bacteria, a common cause of pneumonia, meningitis, and bloodstream infections, which can be especially severe in people with sickle cell disease. Now, this doesn't mean that taking preventive antibiotics will make you invincible against infections. They're not a magic bullet, but they do significantly reduce the risk of certain serious bacterial infections. Just like any medication, preventive antibiotics can have side effects. They can also lead to antibiotic resistance, if not used correctly. That's why it's crucial to take them exactly as prescribed by your healthcare provider. Skipping doses or stopping the medication prematurely can not only reduce its effectiveness, but also potentially lead to antibiotic resistance. Remember, antibiotic prophylaxis is just one part of the infection prevention puzzle. It's a team effort that also includes vaccinations, a healthy lifestyle, and prompt attention to any signs of infection. So, while living with sickle cell disease may increase your risk of infections, having preventive antibiotics in your toolkit can be a game changer. They may not be a cure-all, but they're a powerful ally in the fight against infections. Taking your preventive antibiotics as prescribed is a key part of infection prevention, so stay strong, stay informed, and keep up the fight. You've got this. Your daily habits can have a big impact on your immune system. Indeed, the choices we make every day play a critical role in maintaining our health and resilience, especially for those living with sickle cell disease. Let's delve into 3 key lifestyle factors that can help strengthen your immune system: diet, exercise, and stress management. Firstly, a balanced diet is the foundation of good health. Consuming a variety of nutrient-rich foods can help bolster your immune system. Think fruits and vegetables, whole grains, lean proteins, and healthy fats. Foods rich in vitamin C, zinc, and other antioxidants are particularly beneficial. Remember, there's no magic food that will fight off infections, but a consistently healthy diet can certainly help your body be in fighting form. Next, let's talk about exercise. Regular physical activity can boost your immune system by improving cardiovascular health and reducing inflammation. It also aids in the circulation of immune cells in your body, helping them function more efficiently. But remember, moderation is key. Over-exercising can actually weaken your immune system, so it's important to find a balance that works for you. Lastly, let's not overlook the power of stress management. Chronic stress can wear down your immune system, increasing your vulnerability to infections. Techniques such as meditation, deep breathing, yoga, or even just spending time in nature can help reduce stress levels, enhance your mood, and ultimately support your immune system. Incorporating these lifestyle changes may seem challenging at first, but small, consistent steps can lead to big changes over time. Start by adding more fruits and vegetables to your meals, taking short walks daily, or dedicating a few minutes each day to deep breathing or meditation. Remember, every positive action, no matter how small, contributes to building a stronger immune shield. It's also important to note that while these lifestyle changes can enhance your immune system, they are not a substitute for medical advice or treatment. Always consult with your healthcare provider before making any significant changes to your diet, exercise, or stress management routine. Adopting healthy lifestyle habits can give your immune system a much-needed boost. Remember, you have the power to strengthen your infection shield through your daily choices. Let's continue to fight together, one healthy habit at a time. Knowing the early warning signs of an infection and when to seek medical attention can be a lifesaver. It's like having an early detection system in place, alerting you when your body is under attack, so you can respond swiftly and decisively. Let's talk about some common symptoms of infections. These may include fever, which is often the first sign of an infection, unexplained fatigue, persistent cough, shortness of breath, localized pain or swelling, and changes in skin color, particularly in individuals with sickle cell disease. It's important to remember that these symptoms can vary widely from person to person and from one infection to another. It's always best to consult with your healthcare provider if you're feeling unwell or notice any significant changes in your health. Prompt medical attention is key when it comes to infections. It can make the difference between a minor health issue and a life-threatening situation. If you suspect an infection, don't wait. Reach out to your healthcare provider right away. Remember, time is of the essence. The sooner you seek treatment, the better your chances of a quick and complete recovery. In addition to recognizing the signs of an infection, it's equally important to have an individualized infection action plan. This plan should include knowing how to contact your healthcare provider, what information to provide, what steps to take while waiting for medical attention, and when it's appropriate to go directly to the emergency room. Your infection action plan should be designed in collaboration with your healthcare provider and tailored to your specific needs. It's a roadmap guiding you through the steps you need to take when you suspect an infection. This plan, along with your vigilance in recognizing the signs of an infection, forms a crucial part of your infection shield. Being vigilant about recognizing and responding to infections is a crucial part of your infection shield. Remember, in this fight against infections, knowledge is your best weapon. Equip yourself with the right information, stay alert to the signs, and always be ready to act. You're not just surviving with sickle cell disease, you're thriving, and we're here with you every step of the way. As we've seen, infection prevention in sickle cell disease involves a combination of medical interventions and lifestyle modifications. Understanding the increased infection risk, embracing the power of vaccination using antibiotic prophylaxis, incorporating lifestyle immunity boosters, and promptly recognizing and responding to infections form the pillars of a robust infection shield. Remember, while infections pose a serious risk for sickle cell patients, you can significantly reduce your vulnerability with the right knowledge and precautions. Stay strong, stay informed, and keep your infection shield up. Before we wrap up, here's a quick disclaimer. The information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decision should be discussed with a licensed physician or qualified healthcare professional, especially if you have existing health conditions or are taking medications. Thank you for joining us in the Victory Education Lounge for this crucial discussion on infection prevention in sickle cell disease. Don't forget to like, subscribe, and share your thoughts below. Your engagement helps us create more content that educates and empowers the sickle cell community. Until next time, this is Maurice, reminding you that with knowledge and vigilance, you can build a powerful shield against infections.